During the month of February, Florida Hospital Waterman turned their iconic awning red for Heart Health Awareness Month. They also hosted heart health seminars, breakfast, and luncheons. We stopped by the Women's Hot Topic Breakfast to chat with Cardiothoracic Surgeon Dr. Gary Allen to talk about the importance of educating women about heart disease.
Women's heart disease is different. Women express heart disease differently than men, where, for example, you hear about the traditional crushing chest pain or the sharp pain that sometimes radiates to the back or to the left side of the body. Women, that really happens maybe 50% of the time. So women tend to present with heart disease much later than men. They tend to have actually higher risks of heart disease once the diagnosis has been established. And it's mostly because they don't realize that they're really at risk for that. So heart disease in women is really a very big deal, and I think it's a very undereducated deal, and programs like this today are just great steps forward to trying to educate the community. Cardiovascular disease is a complex of a lot of other different inputs. It's our cholesterol, our exercise, diabetes, family history, smoking, stress, and so forth. So there's usually not just one element, that solves all of those issues, and most of it is lifestyle issues. So there are a lot of tools available for us, to help manage those, but it really is a really committed approach to get patients well, because it's typically not just one thing. So, for years we've had patients come to us, a lot of them females, and they would say, well, my blood pressure is 110/60, I have low blood pressure. But the reality is the low has kind of come back down to the normal. And maybe 110/60 isn't really low blood pressure anymore. 110/60 is getting to be pretty close to normal blood pressure. And as we increase our blood pressure, it has real effects on the risk of dying from heart surgery or from dying from heart disease. So just a simple idea, if you take a look at those patients whose blood pressure are 120/80 on average, and you compare them to the patients that have a blood pressure of 140/90. So if you just go 20 up higher on the systolic and 10 up higher on the diastolic, that increases their risk of dying from heart disease by 100%.
Join us April 6th at the Westin in Lake Mary for the 5th Annual Celebration of Life Gala. This year's entertainment is a departure from past galas that featured soft rock bands of the 70s. This year's event features comedian Tom Papa, who spent most of last year on tour opening for Jerry Seinfeld.
It'd be good if you knew exactly when you were gonna die. Then you could at least plan it out, They should give you your death certificate and your birth certificate on the same day. And that last year you could enjoy yourself. Yeah, good luck, Visa, like I'm paying that bill. Eat whatever you want. 12 o'clock, time for my mayonnaise smoothie. What's that? I can buy this whole living room set with no payment till next year? Oh, really?
Our own Mark Roberts will be returning for a 3rd year as MC. We'll have a recap of the event in our May episode. You'll find more information about the services offered at Waterman Heart Center, as well as contact information when you click on the Hot Topic story link on our homepage at yourhometownhealth.com.